fact, in my experience in mental health, that things don't present in neat parcels. Very, very rarely do they. You know, having designed services around psychosis, only 7% of psychosis presents in a neat parcel. And in fact, many things, it may be secondary to other problems. You know, I sat in a workshop this morning where they have an exclusion criteria for eating disorders, but the case they presented had eating disorders as part of their problem. And I think that's the difficulty, that things don't present neatly. And it's also tied up with people's lives. And the same, it doesn't present at a neat age either. You know, and we heard comments from the young people saying about their needs in terms of for a service may vary, and yet we commission by age. I'm not sure those things are that helpful, but I don't necessarily have the solutions either. But I'm not sure that some of the ways in which we try and package things or try and cost things or commission things are that helpful, and to some extent that then drives our behaviour. Because although, you know, people say, well, I'd like to do things differently, there are lots of things that drive service delivery that are around these kind of issues, and why it's important to have commissioners here, managers, policymakers, because sometimes these can be inadvertent legacy of the way in which we either charge for services or the way in which we divvy up services or take responsibility for services. But it means we then, the delivery experience of that means that people find themselves falling into categories which actually aren't that neat and which actually hamper us working together. And I think, you know, we've experienced that with an age split in terms of between child adolescent services and adult. We experience the same when you try and package things up in neat disorders, because in my experience very rarely are things very neat, and particularly emerging mental health problems, this age group, it's certainly not neat, because it is a revealing picture. And so to try and package things around disorder, particularly for this age group, I think would be a huge mistake, because these people will constantly be making transitions because of the revealing nature of mental health problems as they emerge.
Just a quick one. I'm just thinking about the many times I've sat with a sheet of paper and I've listed all my staff that I've got within the service, and I've thought, right, how do you cut this cake really? Do you cut it down tier 2 and 3? I didn't have 4. Or do you cut it down professions? Well, that didn't work because we need multidisciplinary. Do you cut it down, I have 4 PCTs, so I divide it up that way. Or more recently, we were looking at disorders. And I suppose what I would like is none of that's right. You need somehow young people to be able to access all aspects of the service and fit the right service around the young people. But then you can end up with an amorphous blob and you don't know what you're doing. So I think we've got ourselves some real management challenges. And I do think that the pathway, that works well because you're then joining up across primary care and other agencies. So pathways are attractive. As long as it doesn't stop young people getting to the service they need, so that where flexibility comes back in again. So it's enormously difficult to get it right. But I think it's the same problem that we've got with multi-agency working again. We can kind of see what we want, but it's the how. How do we get there? And I don't think any of us have quite got the answers yet, except I know it's right to keep trying.
Can I make one more comment? The bulk of NHS resource is actually in its people. You know, it's not in buildings and structures. You know, although we hear governments talking about stripping out, you know, the fat that's there, or this, but most of it lies in resource. And we have to think about how we use resources differently. That's one thing. And there are some models. I mean, I look at the MAPA model in terms of working with people with complex needs who cut across the, you know, in terms of defined in terms of risk. And I see how we can bring together police, health, lots of different agencies who actually are in different service structures to work to think about how they information share, how they work and develop a joint care plan, identifying who is a lead on that. And I think there are other models like that which we could look at where we don't sit in structures but we use the resources. And there are models, again, from the US where we wrap those resources around people and we stop thinking in terms of structures. And I do think that would be probably, I don't have people that sort of say to me, well, what would it look like? We talk about transition service, or we talk about, I don't have that at all. I want young people and families, and it may vary what wraps around them. and it may vary how long those things wrap around, and it may vary what are the different things that wrap around. But we need something that wraps around, and we need a willingness from those agencies to move out of their structures and to mobilise resource around young people and families. And that would be the model I'd be advocating here, rather than by disorder or sitting in a structure. It goes to the heart of the matter is we're here for young people and families, and we have to think about how we organise ourselves around them, not organise the structures and then fit young people and families into them. And that's the way in which we configure services, it's the way in which we commission it, and it needs to be really revisited as a whole way of working, a whole philosophy.
It goes back to the point about actually young people and their families have to be an active participant in that as well, not something we do to them. And that, I think, is the essence of what we've been talking about here.
Sorry, I was just going to say, I think it's another one of those questions that's hanging in the air, because I think there are different philosophies between CAMHS and adults, and the wrapped around services and the diagnosis. We talked a bit about it this morning, and it hangs there, doesn't it? And we don't deal with it. And I guess there's a couple of questions that you need to be taking back and saying, you know, why isn't this actually working for us locally? Why aren't we having these discussions? And it's one of the things that always surprised me when I moved into mental health services, that you work with children and young people or adults where you talk about difficult questions, but as a group we don't do those difficult questions that we've talked about today that are still hanging in the air. And I don't have a solution for how you do that, but I think we need to have those discussions locally about those difficult questions, because we won't move on until we've got that joint understanding.
Jeff Love from Stoke. An adult commissioner in mental health, but also in a joint commissioning unit, which includes the local authority. And I'm actually it's just struck me that one of the things that has been most surprising about this discussion is one of the big issues in terms of service transition for children to adults is actually around personalisation. And the introduction of things like personal health budgets and personal budgets in social care, which could give quite a lot of leverage to giving people choice in how their services are configured around them. And linked to that, the fact that the personalisation approach in adult services looks at a much wider spectrum than just healthcare services and social care services. And the whole thing around the total place agenda, which is coming out at the moment, again, is beginning to draw all of those things together. So maybe there is a bit more leverage to move things forward than you think there is at the moment. That was just the point. I wasn't going to make that point originally, but I have now.
Thank you very much. I'd like to wind this session up. I want to do a couple of things. I think today's conference actually has been about a challenge. It's about helping us understand the complexity of transition, all the issues, all the aspects of commissioning and service cooperation and interprofessional working. It's about understanding more the experience of young people in that process, and I think that this afternoon has been really helpful in doing that. So I think I'd like you to feel that challenge going back, and I feel this going back to Wolverhampton now. So thank you to everybody for enabling a much better understanding of that challenge.